Authorities across Asia are on high alert after Chinese health officials confirmed the virus could spread through human contact. 15 medical staff treating infected patients have been diagnosed. Authorities confirmed almost 300 people in China have contracted the virus and 6 deaths have been reported in Wuhan. Airports in Asia, Australia and the United States have introduced mandatory screenings for passengers arriving from Wuhan. And those who present pneumonia symptoms will likely be quarantined. The mysterious illness continues to spread across China. This evening, Taiwan confirmed its first case of the virus. Patients in Thailand, Japan and South Korea have also been diagnosed. Now, as millions of Chinese are traveling this week for the Chinese New Year holiday, there are fears that the virus could spread even faster. Scientists at the University of Hong Kong estimate the virus outbreak has already spread to 20 mainland cities and that thousands of people could already be infected.
Our best guess in terms of the mode, which is the most likely number, is somewhere in the region of 1,300 plus. So it is absolutely critical that public health authorities recognize a super spreading event in the very earliest stages, before it goes absolutely explosive.
Tomorrow, China's National Health Commission will hold a briefing on the virus, and Chinese health officials will join the World Health Organization's emergency meeting. The WHO could decide to declare an international public health emergency over the outbreak. That's a rare designation used only for the gravest epidemics. Our correspondent Lynette Lim joins us from Shanghai right now. Lynette, tell us, what kind of measures has Wuhan implemented to stop the further spread of this virus?
Well, the city of Wuhan has started to impose entry and exit, stop people from entering and leaving the city. But these controls, the foreign ministry took pains to emphasize, do not amount to a travel ban. Basically, for instance, travel agencies have been instructed to not organize outbound group tours. Cars will be inspected. Cars entering and leaving Wuhan will be inspected for live birds and wild animals. And there will be infrared temperature monitors installed at key transport nodes like the airport, train stations and bus stations. There will also be checkpoints, temperature checkpoints at these key transport nodes.
为了应对武汉肺炎疫情，中方采取了严密的措施，也做了全面的部署。我们将坚决遏制疫情蔓延的势头。刚才我在回答路透社和法新社记者提问时也说过，我们也本着负责任的态度，与有关的国家、国际组织和港澳台地区保持密切沟通，跟他们分享疫情的信心。我们也愿意与各方一道来携手应对疫情，共同维护地区和全球的卫生安全。
Lynette, authorities in China are holding a briefing tomorrow morning on this outbreak. Do you have any idea what we can expect to hear?
Well, it has been about 6 weeks since the virus was first detected. So what we're looking out for at this point, we do know that the authorities, together with the World Health Organization, has been doing contact tracing, has been assessing the environment at the seafood market where the virus is said to originate, and they have been studying the virus. So we're looking out for new information. For instance, which animal, what kind of animal could the virus have come from? Recall that during SARS, the SARS virus was a virus in bats that transmitted to humans via civet cats. We are also looking for information regarding how the virus could have spread. Earlier we heard that there was confirmed human-to-human transmission, and there have also been reports that the medical workers in Wuhan could have been infected by a single carrier, also known as a super spreader. So there may be more information from authorities about the identity of the super spreader. Was it a patient at the hospital, for instance? So far, what has been confirmed is that there are 2 human-to-human transmission cases in Guangdong, and these were patients spreading the virus to their family members. So we will be looking for new information, but also for statements from the authorities in response to concerns with underreporting, to concerns over cover-ups. There was a spike in cases over the weekend that led many to conclude that there must have been some cover-up. Some analysts have clarified that it's actually because there is an administrative procedure in the sense that for cases to be confirmed, there is a delay because there are 2 tests that need to be done. First at the local hospital and the second test at the Disease Control and Prevention Agency in Beijing. So there's a bit of a lag time there, leading to some questions over the robustness of the reporting system in China.
Plenty of questions outstanding on this one. Indeed. Lynette, thank you very much for that update. That was our correspondent there in Shanghai, Lynette Lim.